Hi, I'm Pamela Addy, and we are going to jump into week 10, chapter 5. And this is to review basic marketing principles. Now, we've talked about marketing a little bit earlier, previously, and if you're the administrator of a smaller facility, it may very well be your job to do the marketing. And even if you're in a large organization with a marketing team, they will need your guidance and your expertise in order to really perform effective marketing. I can remember my first hospital imaging director job when I realized I was the only person in the entire hospital who did what I do and knew what I knew. So believe me, you will spend a lot of time educating the marketing team about imaging. You know, we didn't used to see a lot of marketing in healthcare. So why are we seeing it now? Because there's so much competition, more competition for patients than ever before. And here is their definition of marketing. And I want to point out the most important words on this slide are value, delivering value. We need to bring value to our patients, to our referring physicians, to our insurance companies, to anyone who is using our services. I think this is a good way of thinking about it. Really thinking about the customer. The customer must receive value and the organization must benefit, right? So that's the entire premise about marketing. And do not underestimate the long-term patient relationships in healthcare where we provide services throughout the life of a patient and their family. So just because they don't need us now doesn't mean they're not going to remember the marketing they see this year when they need us next year. These are all good reasons why marketing applies to how it applies to healthcare. And then you can also think about it in terms of imaging, awareness, our image. We need to enhance our visibility. We want to build market share, obviously, and we want to influence customer decision making. So we want to help them make good decisions about screening mammograms, getting their colonoscopies, and anything that we can help them in terms of decision making, and attracting high quality medical staff, right? Physicians, nurse practitioners, all medical staff, and all employees. Now, this is a great slide to show why marketing is particularly challenging in healthcare. Healthcare is intangible, right? It's not like we're producing a product, a physical thing that people can buy. It's variable. And consumers can't really sample it before they purchase, right? So go through this slide because it really does help understand why it's particularly challenging to market in healthcare. And if we understand all of these reasons why, we can address each one and mitigate the challenges. Very important to realize as we're trying to differentiate ourselves, we often lack industry-wide data, whether this is healthcare data or imaging specific, especially imaging specific data. You'll be surprised at how little we can obtain, and we cannot always market direct to consumers, right? So we need to market sometimes to insurance companies, to referring physicians. We know that in today's world, the insurance companies want to direct care. So we need to make sure they're on board. Think of the services where the patient does have the ability to choose their own care. And again, screening mammography is a huge one. They get to choose, typically they get to choose where they go for their mammography. And always remember that it's the mother and wife or the family in the family who usually makes the decisions as to where the entire family goes for health care. And like anything else that we've talked about, we need a strategy, a plan, and the right tactics. We also talked previously about using the right level to achieve our objectives. So an example would be targeting neurosurgeons, neurologists, when we have a new 3T MR. And the marketing process consists of analysis, strategy, planning, and of course, implementation. And it doesn't actually have number 5, but I would add monitoring. So here's a list of the external factors that impact a marketing analysis, right? So you're going out and you're going to look at your competitors. You're going to look at the setting that your imaging center is in, or your hospital is in. Is it inner city? Is it in a suburb? Is it in a rural area? Those types of things. So here's a list of the types of things that you need to consider as external factors. I don't know if this is something you've covered. If you're not familiar with a SWOT analysis, leadership would love to have you present in this format. So I would learn it. This is a good slide to talk about it. SWOT stands for the strengths of your department or your imaging or your hospital. The strengths, the weaknesses, the opportunities that exist in the market, and any threats, and that could be other competitors that are coming in or building. So here are some good ideas when considering your marketing strategy. Most importantly, know your objectives you're trying to achieve and stick with them. If you start getting all helter-skelter or diluting your marketing, it's not going to be effective. Obviously, the plan is the roadmap that's going to get us to our objectives. For implementation, determine the timeline and the activities for implementation, and set up some kind of chart where you can check off the items, the activities as they occur, and as your objectives are achieved. This would be an excellent way to keep leadership informed as to your process and that you're following a designed plan. Charts should always be visual and simple. Things like red and green, people know what that means. Check marks. Simple, that they don't have to study something. They should be able to see it and immediately understand if things are on target, off target, delayed, ahead of schedule, achieved. Now, I know that you all are aware of the criteria for setting goals. Remember that your objectives must be measurable. And you must be able to measure them before you started the marketing plan and after. And then make sure you monitor as it goes. This is another great way to keep leadership informed. And it helps you gain credibility for your next project. Most important thing is if leadership sees you set goals, plan, track, and you can show success, you will receive funding for the next thing on your list. If, however, you're sloppy about these items, you may not get the funding for the next thing. And slide 17 just talks a little bit more about the marketing plan. You can read that over. Any way you look at it, marketing is in our job description. Understand the differences and the challenges for healthcare marketing. Create a plan, monitor it, and show success. And show off your work. Thank you.